meaning if we're not breathing properly, if we're not doing diaphragmatic breathing, meaning breathing from our belly, we're not going to be moving the internal lymphatic fluid from our organs, like below our rib cage down. So our legs, any of that. And lungs are also associated with the emotion of grief.
It's time for a real conversation about health. Hi, I'm Dr. Andy Michaud of Total Body Wellness Clinic, and each week on Restore the Real, I'll sit down with a guest to discuss how developing or overcoming health challenges has shaped the way that they live their lives, what they've learned, what they've changed, and how they're moving forward. Health is a deeply personal topic, and each person's experience is unique and significant, no matter the diagnosis. From clinicians to regular people to endurance athletes, you'll hear real stories from real people who aren't afraid to dig deep and share the incredible lessons and thought-provoking insights they've discovered while learning how to survive and even thrive under difficult circumstances. Welcome to Restore the Real. Hello, and welcome to Restore the Real. I am Dr. Randy, and I am pleased and just honored to have Dr. Caitlin here with me today. Dr. Caitlin, you may know her more as Detox, and she is a good friend. We met 6, 7, 8 years ago
Yeah.
through a health coaching that we were doing, and just really she and her husband and I became good friends, and just so grateful that she's here today because she's a wealth of knowledge when it comes to detox and drainage pathways and lymphatic system. So Dr. Caitlin, welcome to Restore the Real.
Thanks. Thanks so much for having me. I'm glad we could nail down a time with your busy schedule and my busy schedule. So I'm so excited to be here with you.
Yeah, thanks so much. So you've done detox work and health coaching for a long time.
Mm.
Like, it's not new to you.
Sure.
What was it though? Now you focus a lot on teaching people how the lymphatic system works, drainage pathways. What was it that shifted you from kind of focusing on just talking about detox to lymphatic system and
Yeah,
drainage?
such a good question. So, yeah, my husband and we've been doing detox for over a decade now with people and clients. Um, I became a certified functional medicine practitioner, and that was really a big component. Most people that would come into us with health challenges, there was always some form of detox that needed to happen, whether it was heavy metals or parasites or mold or Lyme or chronic infection or whatever it may be. So that has always been a big part of what we would do with our clients. But taking it a step back even further, what I used to do before I even got into functional, I did actually a lot of peds work um, with, well, obviously kids and pregnant women. And a lot of what I would do would be lymphatic drainage and teaching parents how to do lymphatic drainage on their kids. And so that was a big part of what I used to do. And for some reason, when I shifted into more of the functional component, looking more at lifestyle and nutrition and like living and stress and all those kinds of things that, functional doctors and that you look at, I got away from the lymphatics, which I don't even know why. Like now thinking back, I'm like, how'd that happen? So I got away from that a long time. And it wasn't until like I got cavitation surgery done. And actually, I think you were around when I had this done
Remember that.
because it was terrible. Like I had some of the worst cavitations. Like they even said cavitations on my cone beam scan, which, radiologists avoid that word like the plague, right? Like they do not want to use the word cavitation. They'll say like lucency or like they'll use other words to describe it. But they actually use the word cavitation for 2 locations in my jaw. So I was like, okay, I got to get this cleaned out. And I thought I did everything right. I supported my gut and my liver and my kidneys, and I made sure that I was pooping and I was taking really good like support like glutathione and vitamin C and all of these things. And I didn't swell a whole lot. I didn't bruise a whole lot. I healed pretty quick. But a month later, all of a sudden I developed this like skin irritation in and around like my breast tissue. And I was like, well, that's kind of weird. Like, looks a little like a fungal thing. That's super weird. I've never ever had this before. I did some things, did some fungal stuff, and it just kept getting worse and it kept spreading. And I used to wear shirts that would like come up to here because like I'd have it like all the way up through my collarbones and everything. And I was like, what the heck is happening here? It was my lymph. All of that like garbage went into my lymphatic system. And I was like, how could I be so naive and forget about the lymphatic system? And so that was back in like 2018. And so since then, I really owned in on it on myself because I had my tonsils taken out, I had adenoids taken out. Like I've had lymphatic issues my whole life, and I just didn't put two and two together until this showed up. And what got me teaching it online was um, I actually avoided going online for a very long time, very, very long time. Cause I'm like, what the heck am I going to talk about? Like, I like talking about a lot of things, hormones and detox. And, like, I just love talking about physiology and biochemistry and those kinds of things. And I was like, what is it that I'm going to talk about? And I started seeing people teaching lymphatic drainage online, and they just weren't doing it properly. Like they were missing like steps or they weren't doing it in the right order. And I was like, well, this isn't going to work. People aren't going to get results. So it was really like me having to be like knocked over the head with this like fungal infection on my skin. And then seeing people teaching lymphatic drainage in what I view as not ideal, can people still get results doing it that way? Sure. But they're not going to get the best results. And so that's what got me to go back to just drainage in general. So lymph, gut, liver, kidneys, and lungs, and then skin. So those three for me are like the foundation. When one of those isn't working, you're going to have other problems. And so that's how I ended up talking about drainage. And if you were to ask people, take a poll, they'd probably say they wouldn't call me a drainage doc. They'd call me like the lymph doc or something like that. So that's how I ended up where I ended up.
It's funny that you said like you kind of went away from drainage, and I find that it's easy to lose sight of that because it's so easy then to focus on, well, I got to kill and I got to bind and I got to get out these metals and toxins and
Mhm.
chemicals, and then it's like, wait, why does this person feel like garbage? Why is their skin erupting, and why do they have gut problems? It's so easy to lose sight of that. And yet, I agree with you. It is like the foundation of like drainage is the foundation of I think any program, right? It has to be.
I believe it's the foundation of health, actually.
I
When
agree. Yeah.
we lose our ability to remove toxins and waste products from our body and things start to accumulate, because if we're not draining, we're accumulating. It's that accumulation that is the problem that drives inflammation, that causes hormone imbalances, that causes fatigue, that causes autoimmunity, that causes like the list goes on and on. And so for me, I was like, well, this just makes sense. Like, let's take it back to the basics. Let's get people to understand how to support their drainage. And then from there, then they can go and they can work with somebody on hormones. Then they can go and work with somebody on truly detoxing, whether it's heavy metals or parasites or molds or whatever it may be, but their body has to be able to remove the stuff first. So it's it's a important thing that unfortunately we've lost the not lost the ability to do, but based on the world we live in, we have to put a little more effort into our drainage pathways now.
Yeah. For those that may be thinking like, okay, wait, lymph, drainage, hearing these words, most people are familiar with cardiovascular system. Well, I know that. Musculoskeletal, I got that. Endocrine. But when they hear lymphatic, it's kind of like, well, okay, what is that? Can you describe, maybe for those that are not familiar with the term drainage or lymphatic system, just what is it and how extensive is it?
Yeah,
'Cause it's pretty phenomenal how it
it
works.
it's wild. So The lymphatic system is literally the mirror to your circulatory system, so your blood supply. Think of it like your blood, your veins bring oxygenation and nutrition to every tissue, cell, gland, and organ in our body to make energy. And that energy is what we use for everything, for healing cuts, digesting food, um, making hormones, producing enzymes, draining, all of it. Like everything our body does, we need energy to do it. And so blood brings the nutrients and everything we need to the tissues in order to make that energy. Well, making energy comes with a cost. It also makes byproducts. It's a chemical reaction. So it makes waste products. And those waste products have to be removed, meaning they can't just sit in the cell or in and around the cell. Because what will happen is waste, just think of like waste in your house. If you don't take the waste, the garbage out of your house, it starts to decompose, it starts to stink, it starts to like attract flies, like it gets gross. The same thing that can happen in our body. And so the lymphatic system, what it does is it literally removes the waste products from our tissues and our cells and our organs. And it ultimately returns it back to the blood supply after it's been filtered out through lymph nodes. So a lot of people know like lymph nodes and they associate like lymph nodes and cancer and, that kind of thing. But lymph nodes are kind of like the security guard at the airport where it's scanning everything to say, like, okay, this is safe, this isn't safe. And if something isn't safe, like there's a pathogen or there's a harmful toxin, it will then call on things like lymphocytes to break it down so that it doesn't continue to just like spread throughout your body. So the lymphatic system is like the sewage system of our body. It's literally like the cleanup system. It keeps everything clean. It's part of our immune system. It's also part of our transportation of fatty acids. So like when we eat, the fat from the food we eat gets absorbed into our gut's lymphatic system, our gulp system, which then gets absorbed and then used after it's like once it's been absorbed into the lymphatic system. So the lymphatic system has a few really important parts. And the craziest part, though, is it doesn't have a pump. So, unlike our blood supply that has a heart, the lymph has no pump. The only way it moves is if we physically move, whether like contracting our body, like moving our body, or like physically moving it using like our hands, like massage or a dry brush or a gua sha tool or one of those like wooden paddles or whatever it may be. So that's like the lymphatic system in a nutshell.
Cool. And it's amazing how extensive it is.
Mhm.
And again, and as you talk about how essential it is. One thing that I found really interesting is we think of our digestive system as that's where we're absorbing, which we are, and assimilating. But you touched on something really important, that these fatty acids, they have to go somewhere. They're not just in the digestive system and then they're all of a sudden in the bloodstream, but that they're actually taken up via the lymphatic vessels and then processed and then sent throughout the body and then finally back into the bloodstream, which it's again something that's overlooked. And
Mhm.
we think of how important those fatty acids are. So if the lymphatic system's not working, then your gut could be probably not working well if your lymphatic system's not, but you can't transport those essential nutrients, which is amazing
It's
how
crazy.
everything works together.
Well, and
So
I
when
don't
it
know.
works, go ahead, sorry.
Oh, no, I was gonna say, I don't know if you've heard too, they're starting to think that there may be something called leaky lymph, kind of like leaky gut, where the fatty acids, so the fats from our digestive system leak out of the lymph, which could be one of the reasons why people who do everything right, they eat clean, they exercise, they do all these things, but they can't lose the weight. It's a problem with their gut and lymphatic system where the fats, the fatty acids are literally leaking out into like their abdominal space, which is then increasing the amount of adipose tissue, the amount of fat cells that their body is laying down. And so, lymphatic drainage, I don't even know how many, I can't even count how many people who are like, I just started doing your specific 7 and being consistent and doing nothing else. I've lost 20 pounds in the last year. Why? And I'm like, well, because you're actually clearing that stuff. Stuff's actually finally moving and you're not accumulating more of those, like if that was the case for them, they're not accumulating more of those fats, which is contributing to their weight gain or their inability to lose it anyway. So it's wild some of the stuff that's coming out with um like lymphatics in like the big picture kind of thing.
It's really interesting you bring that up. I've heard of leaky vessel with the lymph and listened to a couple talks on that. But I had not thought about it in the way that you just described as leaking out of those fatty acids, which are now, depositing in the gut, which is fascinating. So thank you for bringing that up. And that is something to really consider when there is that increased weight or inability to lose weight. We want to go to diet. We want to go to exercise. We want to go to now it's medication. But something as simple and as complex as the lymph is the place to look. So when it's working well, it's like amazing, right? The
Mhm.
body is like, man, do anything, process things. But a lot of people don't have a healthy lymphatic system. What are some of the main things that you see that gunk up the lymphatic system or like really inhibit it from working? And is it the lymph at first that gets congested, or are there other organs that get congested first? Or what is that process? Describe that for us if you would.
Yeah. So I do think it's going to be a little different per person. So, like, I'll use me as an example. I honestly believe that I had a lymphatic issue very young in life. I had my tonsils removed at 7 because of chronic strep throat. But I honestly don't think I had chronic strep throat. I had chronically inflamed and swollen tonsil. And knowing now what can cause swollen tonsils, I'm like, well, duh. So, looking at things like, okay, are you a mouth breather? I'm a mouth breather. Okay, what causes mouth breathing? Tongue ties. I am massively tongue tied. Now, that is the next step on my road to addressing everything is getting my tongue tie released. Because when your tongue can't sit on the roof of your mouth, you're not developing your jaw properly, which then means when you sleep, you're not getting proper air in. So, tongue ties, big problem. Mouth breathing, big problem. Food sensitivities is a big problem. Um, I grew up eating rye bread and pasta, especially when I turned vegetarian at the age of like 12, because I didn't I didn't like how my mom cooked meat. It was like tough and chewy and like I didn't like it. And honestly, it was something I could control. I couldn't control a whole lot in my life. I wanted like at 13, but I can control what I put in my mouth. So I went vegetarian. So, like doing all of these things, so when I went vegetarian, I obviously ate more things like more rye bread with peanut butter or more pasta with like cheese. I'm very gluten sensitive. Like I can't touch the stuff. So that caused swollen tonsils. So people need to look at things like food sensitivities, mouth breathing, tongue ties, but then looking at things like chronic infections. So it could be chronic strep, or it could be things like chronic Epstein-Barr, or it could be things like living in a moldy home, or it could be Lyme or the co-infections, or it could be any of those things where it's a chronic issue. Because remember, our lymphatic system is part of our immune system. So if our immune system is constantly having to like combat something, whether it's, an infection or it's a food sensitivity, so it's driving inflammation, it's always on like alert. Then there's like other things like wearing tight clothing. So when I said like we don't have a pump for our lymphatic system, if we're wearing constantly tight clothing, like, and I mean clothing, when you take it off, you see like the elastic band around your waist or underwire bras, when you take the bra off and you have like the band around your rib cage, or you take your socks off and you see your sock outline. While you're wearing it, your lymph isn't draining. It can't, because the lymphatic system that we influence most often, about 70% is directly under the surface of our skin. It means that it lays on top of the fat, it lays on top of the muscle. And so when we constrict our skin, we're not allowing the lymphatic fluid to move. And then on top of that, if we're sitting a lot, which most of us do, right? We sit at desks, we drive in cars to and from work, or kids like shuffling kids to and from activities, or then we're sitting at their activities, like we sit a lot. We're not contracting our muscles, we're not getting our heart rate up. Lymph and blood vessels literally lie side by side because remember, the lymph like cleans up the waste from bringing nutrients from the blood. And so when we get our heart rate up and that pulsation honestly helps move the lymphatic fluid up and come up to drain at our collarbone. So lots of things like stationary life, so sitting too much, tight clothing, mouth breathing, um, you know, even having things like surgery, scars, fascial adhesions, tattoos, lymph nodes removed. All of those things can contribute to a congested lymphatic system, or at least a slower moving lymphatic system where things just aren't draining as well. And then we can throw in things like I talked about, like me being gluten sensitive, but there's some people out there that say dairy is a big one because it's like an mucogen, like it increases mucus. So when we increase mucus, it thickens things like the lymph. So those are just a few of the things that I see most often contributing to congested lymphatics.
And I appreciate you bringing that up because it's so easy to look at that and say, well, there's an infection, so I'm going to take this medication or this medication. And you've heard this and I've heard this is, yeah, we took so many medications, antibiotics, but it just never seemed to go away. We got stronger,
Mhm.
stronger stuff, and still there's a big problem. And in many cases, it was never really a full-blown infection as it was, hey, that lymph is stagnant. And if we just work on that, drainage pathways, work on those, then man, things would clear up well. What are some of the indications? Like, how would someone know? And you talked about a few. You talked about, hey, if your skin is like pitting from really tight clothing, which in today's society, right, people like that, like really tight, you know, whatever it is, Lululemon, Under Armour, whatever it is, not
Well,
that, you know, yeah, right.
here's the thing,
A lot
I'm
of the
guilty. I can be guilty of it. Lululemon,
okay.
when people are like, "What's your toxic habit?" I'm like, "It's Lululemon." I've been wearing Lululemon since like 2004. Being from Canada, that's where it originated. And that's my toxic habit. I don't drink out of plastic. I don't, but I wear Lululemon. But here's the
It's
thing.
okay. We all have a vice or two, right?
I was gonna say, but here's the thing, guys. You can't beat yourself up over everything because you can't live in a bubble. Do the best you can. I'm still looking for a Lululemon alternative that's clean. When I find one, you better believe I'll share it. But yeah, like so I'm sorry to interrupt, but like your question was continue.
My question was like, what are some of the first signs? Like when people are, I mean, there's obviously edema and those kind of things that are maybe down the road
Yeah.
problems. Like now it's over. Now you've really got a problem. But what are some of the subtle things that, and you've touched on a few of them already, but some subtle things that people may not think of that have their origins in a drainage problem?
hmm So the crazy part is people are like, well, that sounds like it could be another problem, like a thyroid problem, or that sounds like it could be another problem, like a gut problem. Here's the crazy part. When we thought that we could separate our body into specific parts and it was only going to affect that one thing is beyond me. I don't know when that happened. I don't know why we think our body works as separate parts because the lymphatic system actually has to work with the gut and it has to work with the liver and it has to work with the kidneys and it has to work with the blood supply and it has to work with the brain and it has to. So I'll list a bunch of the most common ones that I see, but you're going to be like, well, that sounds like a lot of other things too. Yeah. But when we like chalk it back, drainage is the first thing that our body has to do. So when drainage isn't working, then we end up with other issues. So some of the common ones, kind of like what you said, down the road, if you have things like lymphedema or lipedema, that is further along, and that is absolutely, partially anyway, a lymphatic issue. With lipedema, there's some other things going on too, but there's definitely stagnant lymph with those two diagnosed conditions. But some of the other things that I see a lot of is brain fog. Usually the brain's not draining. So our lymphatic system, so our brain's drainage is called the lymphatic, isn't draining. And that only drains at night when we're sleeping. So if we're not getting into deep sleep, our brain's not draining. And if our brain's not draining, then we're going to have things like brain fog. Then we might be forgetful. Then we may end up with other things like being more irritable or angry. And then that just trickles down to other gut issues because the gut brain connection as well. So if the brain's highly toxic because of the waste products sitting there, it's then going to send signals down to the gut. So then we can have things like constipation. We can have bouts of diarrhea. We can have bloating. We can have indigestion, like we're not digesting our food properly. We can have problems digesting fat, kind of like what we talked about with leaky lymph. We can have sinus congestion or allergies is a big one. So if you're somebody that has like chronic sinus infections, there is a lymphatic component. Because guess what happened when I had my tonsils removed? Where did it move to? Chronic sinus infections. And then after chronic sinus infections, when that didn't get addressed, it moved to chronic daily headaches. It literally just continued to move up for me. For some people, it moves to earaches. Then some other things could be even hormone imbalances because lymphatics actually help transport progesterone. So if our lymph is stagnant and we have low progesterone, and you got to look at why it's low in the first place, right? Is it low because you're shunting progesterone to make cortisol, or is it low because you have too much estrogen? Like what's happening? But if progesterone's low, then you can end up with other complications as well. And if lymph isn't flowing, progesterone's not going to keep estrogen in check. So there's just like a whole bunch, like cold hands and feet. It could be things like, I think I already said like irritable. And so the list is just like wide ranging. And that's why I think it's so hard for a lot of practitioners to be like, oh, we got to get your lymph moving. Because that sounds like a thyroid problem. That sounds like a gut problem. That sounds like, a brain problem. Like we got to get more fatty acids
Right.
to your brain. So
And then,
those are
and then
just
it's
the
so
big
easy
ones.
then to go on that rabbit hole of, oh, we're gonna like just focus on the gut or the brain, and then you just lose sight of the bigger picture. And all those things, yes, are definitely affected.
Mm.
However, it's so easily missed because maybe it's not sexy. Maybe it's not the,
Oh, it's not sexy. It is not
maybe
sexy.
it's not. We want to go somewhere else. You shared a story pretty recently on Instagram. It was about a little boy or a
Mm.
baby. I don't know if it was
Yeah.
a boy or girl. I'd love you to share that because constipation in kids is pretty rampant. Um,
Mm.
I've had my own challenges with that with kids and have had to work on their gut and their lymph and that kind of stuff. Had I known these tools, you know, 20 years ago, could have definitely helped my older kids more. But yeah, would you share that story and maybe with the focus of, well, you share the story and then I'll ask a question after that.
Okay. Yeah. So a girlfriend called me up and we were talking, catching up, and she's like, "Ah, my little guy, he hasn't pooped in like 3 days." And I was like, hmm. She's like, and now he's getting like grumpy and angry and like, I can tell he's not comfortable. I was like, well, no, yeah, clearly, because we should be pooping every day, every day. And if you're not pooping every day, there's a problem. So I explained to her, okay, well, let's do this abdominal massage. In babies, they call it the I love you massage. But ultimately, you're really just massaging. And I like to use castor oil for the viscosity, for some of the other added benefits. And I do find that when people use that particular oil, they tend to get better and faster results. So I was like, okay, you're going to rub from the left hip down to the pubic bone, do that with like a good amount of pressure. Like this is not lymphatic pressure. This is like, we're trying to massage the intestines. Like
We're getting deep.
we're trying to get the poop to move is really what we're trying to do. And then we go to the left rib cage, down to the hip, down to the pubic bone. And then we go across the rib cage. So right ribs over, down. And then we go right hip to right rib cage over and down. So we're ultimately working our way backwards to making like a full circle. And so she did that. And I was like, okay, you want to do like each section for like 20, 30 like seconds kind of thing, just to really make sure that we're just moving things. And babies love it. It helps release like gas and it just gets things moving. And so she did it that morning and he hadn't pooped by, I want to say like just before bed. So she was like, oh, I should do it again. But she got busy with like other things and totally forgot and ended up like putting him to bed, totally forgot about it. She had a busy morning the next morning with work. So she got, doing her thing and her nanny was watching her son. And, when she was done with work, her nanny goes to her, I don't know what's going on, but just so you know, he had a full on blowout. Like he had poop all the way up to his neck. And she was like, oh my goodness. And so the reason that I shared that story was sometimes we have to be a little patient with when we do something. Our body may not respond immediately. Like, yes, we want it to, but it might not be able to. It may need a second to integrate what we just did to it. And kids are a perfect example. More times than not, kids will integrate a lot quicker than adults. They've had less traumas, less exposures, less all that kind of stuff. But we still have to be patient. And really, she was like, that made me realize that I can't be uber impatient. Like I just have to trust that, this is gonna work. And after that, he was like his happy go self again, just ready to go on with his day.
That's so awesome. I think the reason I wanted to share that one is because of how like simple it is with kids. You may not, it's easy to go to whatever product it is, but it could be something as simple as just that
Mhm.
massage. And it's a good connection for, the parent and the kid. That touch is a great connection. And then you're able to see, oh my gosh, something so simple as this connection can be so profound.
Right.
Um, and then also, I wanted to bring that up because of what you just talked about, the time. We are in a place where we want to see like results immediately, but our body is not, it doesn't respond like as maybe our brain wants it to. And it really is important to be patient and
Hmm.
to just acknowledge that our body may process things. It's funny as I work with people and we do certain protocols or working on certain components of the gut and lymph with mold or parasites or whatever. They're like, nothing's happening. I'm like, just give it a little bit more time. And then maybe a few days later, oh my gosh, you won't believe what happened. I'm like, actually, I probably would. Um, because it just takes time, right? It's not I do this and I get a direct result. Not always. Sometimes, not always.
I One of my
Um,
favorite sayings is our body is not Amazon Prime. We're not gonna get it, you know, that day or 2 days,
True.
and the reason I love that saying is because I get it. When we want something, we want it. Like, we don't just want it now, we want it 2 days ago.
Yeah.
But we also have to keep in mind, how long have we been dealing with it? Have we been living with this for a couple days, or has it been months, years, decades? And the longer that we've been dealing with it, the more patient we have to be because we have to like unwind and undo everything that got us to that point. So patience truly is a virtue.
I'm curious if you see um, a lot of people with chronic illness, or just, I mean, in general, there's a lot of emotional baggage, emotional, like we all have it, right? Do you see this within the lymph? Do you see a stagnation of people being able to? Because I believe that there's, the spirit component and physical component in every organ,
Mhm.
every tissue. I find a lot of that gets trapped, that emotion or trauma or whatever we want to call it gets trapped in the fascia and the tissues.
Mhm.
Do you see people being able to better process their emotion or traumas when they do lymphatic work? And on the opposite side, do you see more of a challenge with people processing when there is that stagnation in the body?
Yeah, that's a great question. So, what I tend to see, because when we look at like lymph and like the Chinese like organ clock and things like that, lymph and lungs really do go together. They go hand in hand. And the reason that is our lungs are actually moving our lymph, meaning if we're not breathing properly, if we're not doing diaphragmatic breathing, meaning breathing from our belly, we're not going to be moving the internal lymphatic fluid from our organs, like below our rib cage down. So our legs, any of that. And lungs are also associated with the emotion of grief. So I do find that when people start to implement and work on proper breathing and getting drainage going, they almost have this like sadness that comes up and they're like, I just don't feel like myself. Like I almost feel depressed. And I'm like, okay, but ask yourself, why? Where is this coming from? That kind of thing. And a lot of times they're like, once they work through it and they understand it, they're like, oh gosh, like that was something that I was holding on to because when I lost my mom or when my grandma passed away or whatever it may be, they were able to then like actually work through it. But I've also seen things though, because the lymph is so works so closely with like the liver is actually the organ that produces the most amount of lymphatic fluid from an internal organ standpoint, meaning it's going to make the most amount of lymphatic fluid that needs to travel up our thoracic duct. Um, a lot of anger can actually come through because as you're working on lymph and draining lymph, you're also working on liver and supporting liver at the same time. So anger can also come up. Um, it can be fear too, because like as you're working on clearing the lymph, the kidneys have to process more of the toxins that are being filtered out from the lymphatic fluid. So fear can come out. So I really have heard, or and people have shared with me, like I've experienced this, and it's usually that was something that they were holding on to. And as their body's starting to clear things out, these other emotions are coming up. So, yeah, that does happen. Does it happen with everybody? No, it doesn't. But there are those individuals that maybe, I don't know if I want to use the word more sensitive, but that they do notice those types of emotions when things start to rebalance and start to flow the way that things are supposed to flow.
Yeah. I bring that up because I find it really fascinating in talking with people. They'll use certain words or certain phrases or say things in certain ways. And it's like, huh, okay, what is it that's buried in there?
Mhm.
And then what role is that having in what your health problems are? Um, because a lot of that can come, I believe a lot of that can come from that just constant emotional stress that then changes the whole dynamics of things in the body. And
Well, of
really
course.
interesting that I've seen that. Yeah.
Well, and when you think about it too, stress is also going to affect our nervous system, right? And so
Yeah.
if we're chronically stressed, whether it's we're stressed because we're not draining, so now our body is more in a more in a sympathetic state, that fight or flight. It's not in that rest digest. And I always say rest digest drain because in order for you to drain, you have to be in a parasympathetic state. And we're not in a parasympathetic state if we're chest breathing, if we're shallow breathing, if we're go, 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 if we're, shoveling food in our mouth as we're like running from point A to point B, if we're jumping from meeting to meeting, if we're like phones glued to our hand, if and I get it. There's times where we have to do that, but we also have to put ourselves into that rest and digest and drain state if we want our bodies to function the way that they're supposed to. So, what I see in a lot of people is they're like, I'm actually less stressed. And there's times where they feel something, but they don't know where it's from. They don't know why it's there. And that's okay. I don't think it's our job to always figure out where it came from, why it's there. I think our job is to like work through it, let it go so that we can move on. And when people can and that's a hard one for me too, when I'm like, gosh, I feel like I'm just feeling, I don't know. What is that? Like, where is it coming from? I might not ever know where it's coming from, but if I can let it go, my body is going to respond so much better and faster. And so I love that you brought that up because it's an interesting thing, especially since people are becoming more aware of the emotional nervous system, fascial energy, like component that could be the reason why we're in the health position or we're in the health crisis that we're in kind of thing.
You focused, you've mentioned several times about breathing
Hmm.
and, how that breathing and getting the lymph moving, people just feel better.
Hmm.
As breath work has become something more to me than it ever was. Like for a longest time, I just thought of, hey, we just breathe, right? Um, but really, breath can be so powerful for the lymph because the pump that the diaphragm is and how it's pumping the lymph, it's pumping the intestines. And I've engaged in some of those practices on a daily basis for breath work and find that okay, almost daily, not every day. But I find that when I do engage in those, as you just said, I feel better
Hmm.
emotionally, physically, mentally. There is a difference. And I would love to say that I'm intentional about, hey, I'm moving my lymph. I'm not all the time, right? It's more is how is that breath work affecting me, and just being able to be in that state. But that is something again so simple that people can do to be maybe some of the first steps to stimulate the lymph or to get things better moving in the gut. Not the only thing, but really powerful, and highly underutilized,
Hmm.
because we just breathe. We've breathed from the moment we're alive, and so that breath is essential. And as you've talked before and said this earlier, a tongue tie can get in the way. Stress when we're just chest breathing, go go go. You're going to inhibit that diaphragmatic breath that is essential to help the gut, the lymph, the body, and just calm things. So I
100%.
appreciate that you brought up breath so many times because it really is like it's essential.
Well, and that's one the missing pieces that I find too when people are talking about like lymph work. You can do everything right, but if you're not breathing properly, you're always going to be struggling with moving and properly draining your lymph. Not to mention, you're also going to be how you breathe is going to somewhat dictate what state you're going to be in, parasympathetic or sympathetic. And one of the things that I find and that I've been told from my academy is, oh my gosh, me being even just conscious about breathing for 3 minutes, like a couple times a day, just taking 3 minutes and just really focusing on belly breathing, flow controlled belly breathing. My everything has shifted. My mood, my concentration, how I feel, everything has been like massively improved. And so I do think breath is one of the most important things and like one of the easiest and cheapest biohacks that we can all do in order to change the state in which we're currently in. And it's going to like massage all of your internal organs, literally. Like it has so many benefits that everybody should do it. But the problem is we just have to be conscious of it to actually do it, right?
Yeah. And maybe that comes down for people to setting an alarm on their phone,
Mhm.
right? As tedious as that seems, it's like, you get to a point where you see that there's a need, but we get going and forget. So it's like, okay, maybe I do just have to set an alarm. I have my receptionist at the office here. I say, hey, every couple hours, I want you to turn up the music crank it up so that we get up and we move, right? It's like a signal to get up, move, dance, whatever. There are no videos going for sure because no one wants to see that, but it's so beneficial, and just the movement is great to get that going. And then, having a stand-up desk. I've seen you on Instagram. It's like, hey, I'm standing up, moving. I love that ability. Um, when you're doing massage work, and I'm not going to ask you to go through all those points because it's, it's not really conducive here, but a lot of times, and in the past, I've done this where I want to if I'm thinking lymph, but I'm pushing way too hard,
Yeah.
right? Where on our hands should we be using? What's the best
Mhm.
way to stimulate the lymph with our hands are fantastic, by the way. Like they're free. Most people have them, and can use them, right? But is there a um, certain place on the hands? Is there a quality of touch, a lightness, gentleness? Is it more deep? How would you explain that or share that with us?
Yeah, I'd love to. So there's three things that I find that are super important when it comes to doing lymphatic drainage. And one of them is pressure. Then we have order and direction. And this isn't in any particular order. But when we do not take those three principles and apply them, our results are going to be less than what they could be. So when it comes to pressure, I always, always, always start with hands because we tend to be a little more gentle with hands. But the moment I give somebody a dry brush or a gua sha tool or any tool for that matter, we tend to go real deep. Like we're just like, I'm going to go for it. Less is more when it comes to lymph. Lymph means less is more. So it's not like a deep tissue massage. Don't get me wrong. Next week, I'm going and I'm getting me a deep tissue massage and I'm going to have them get in there. But my goal is not lymphatic drainage. My goal is muscle release. So depending upon your goal, you have to determine the amount of pressure. It's even less pressure than a Swedish massage. So how I like to teach it is when we're using our hands, you want to use the pads of your fingers. So like right now I have longer nails than I usually ever have. They're going to be gone real soon because I can't type with these. I don't know how women do this, but you want to use like the pads of your fingers because we have a little bit more nerve endings in there. We have a little bit more sensitive touch. So we're going to use the pads of our fingers, and I like using our ring finger and our middle finger the best. I try and avoid index and thumb for the most part because we tend to be a little more aggressive with these two. Just because there are stronger fingers, we tend to go a little bit more with these two. So what I like to do is I like to have people take their fingers, place the pads of their fingers on their eyeballs, and then I want them to push in. Now, I want you to push in until you start to see like color change, whether it's like the kaleidoscope, whether you start to see stars, whether you start to see even just like lines, whatever it may be. But when you start to see a change, that's too much and you have to back off. That back off, that is the amount of pressure that you're going to use on your body when doing lymphatic drainage, whether it's lymph node stimulation or manual lymphatic massage. So for the pressure, that's how I like to give people like a cue to figure out like, okay, how much do I use? Like, how deep is it? Because people online are always like, you're pushing way harder than that. I'm like, yes, because if I showed you, if I were to like show you the amount of pressure, you'd be like, you're not doing anything. What are you doing? So I exaggerate it, but then I make sure to explain it is very light though. So the amount of pressure you would put on your eyeballs or the amount of pressure you would put on like a very ripe tomato before you bruise it, same idea. So that's the amount of pressure.
Cool. And then you talked about the kind of the direction. This is something that was really actually super beneficial for me that I saw from you, and I had not seen it from others. And it kind of went back to the massage of the baby, but
Oh, yeah.
also on adults myself. And I always remember, being taught, hey, you want to go from the right side to the left. And so, I would work on intestines because there was a time when constipation was a challenge. Um, Man, it was awful. And I would go from this right side, kind of next to, you know, that lower right quadrant, all the way up, across, down.
Hmm.
But you taught it very differently. And I found that that just kind of makes sense. I mean, it was like, wow, this was kind of mind blowing. Um, and could you describe that? Like, again, this is lymph, but it's also for helping with constipation. But it was just very different than what I was taught, in chiropractic school and other places in terms of that direction. And yeah, so
Yeah. So I am a big physiology, biochemistry geek. Like when people talk about love language, like touch and like acts of kindness, no, mine is talk physiology and biochemistry to me, and we're going to be best friends, like best friends. So when I was looking at things, I'm like, hold on here. Like, this just doesn't make sense. Why would we start from the furthest point away and try and move what we're trying to move, whether it's stool, like feces in the abdominal massage, or lymphatic fluid? Why would we start from the furthest point and try and move it all to the end point, like where we want it to go? And then being from Canada, I'm like, okay, if I had a big snow dump and it was like that wet, heavy snow, and I had to shovel, am I going to try and push snow from the furthest point to exactly where I want it to go in one fell swoop? I'm like, no, that's not going to work because that snow is just one, going to get too heavy eventually and it's not going to move. Or two, it's going to continue to fall and I'm going to miss a whole bunch of snow that I'm trying to clear. So I was like, what would I do instead? And I was like, well, I would start where I want it to go and I would do little like strokes to clean up that snow. And then I can move further away and then bring it forward because now I have a clear path. So that's really what I started to do is like think about, okay, I got to clear the path that I want the fluid to go. And a lot of times people think, well, the problem, like let's go back to lymph for a sec. If I have swelling in my feet, the problem's in my feet. No, that's where your symptom is. The problem might not be in your feet. The problem might be in your hips, or it might be in your knee, or it might be in your abdomen, or it might be at your collarbones. And so the thought of like starting where the problem is doesn't make sense. That's just where it's showing up. So always start at your collarbones. This is where all your lymphatic fluid drains, all of it. Never ever start at your toes or fingers because that's the furthest point away from your collarbones. And then always start closest to and then work towards the problem area. But you're always moving towards the endpoint. So when you think of it that way, like moving things sequentially, it makes it so much easier. And like you can think of it as a traffic jam, you can think of it as snow, you can think of it however you want. But moving section closest to where you want it to go and then backing up, it just makes so much sense. And people are like, oh my gosh, okay, that makes sense. Like, why would I start at my toes? Why am I trying to push this thick, gunky fluid from my toes? Which, by the way, do not pull it to your heart. That's not where it drains. It drains at your collarbones. It eventually goes to your heart, but stop pulling to your heart. All of those people out there going, dry brush to your heart. No, 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 no. Collarbones. It's always collarbones. But yeah, so that's just what works for me, like thinking about whenever I'm trying to move something, let's start closest to the end point, like where it needs to go to drain. And then we'll back up to the point where there's the problem, or we'll back up to the beginning kind of thing, like the beginning of the large intestine, the right hip, right? So we'll just back our way up until we get to the end point, all while moving forward. Such a weird way to describe things, though. I'm still trying to figure out the right way to be like, okay, you always start closest to and work away, but still pull to, because people are like, wait,
yeah,
what?
right.
But
Yeah. I was backpacking this past week and took my boys and my hands. I can't tell you how swollen they got.
Mhm.
And for the first little bit, I'm rubbing my hands. And I'm like, wait, it's not going to work. And I would have to take off my bag, and I would work on these upper points. But then I had to put the bag back on and start going again. And it was like, gosh, this is so uncomfortable. And so it's kind of caused me to, maybe your circulation and lymph isn't as good as you think it is. Maybe you need to start working on that more. And it has been something that I've done definitely more regularly in the past 6 months, year than ever before. But that backpacking trip showed me, yeah, you're probably not as good at draining as you think you might be. So,
Well,
last thing,
that
and this
backpack
has been
putting pressure on your apical node, which is where
big time.
it all drains before going to your collarbones, which is why bra straps are so problematic for women because we're always wearing a backpack essentially. So,
Essentially,
yep,
right. Yeah.
yeah.
Yeah. And so what I have to do then, I took the bag off and I would do those lymph points, starting with the collarbone and go to the chest, armpit. It was really beneficial. Again, I had to put the bag back on so it
Right.
didn't clear totally, but it was really helpful. Um, Practical question, and I had this from a few patients. This is at my wheelhouse because they were asking, well, okay, I need to wear a bra. What do I do?
Mhm.
Like, it is there a style, a brand, something that you've found that is not as, I guess, restrictive
Yeah.
or as compressive as other brands? I know the underwire is a big problem, but even the strap. Is there something that you've found that is better, that would be practical for women to look at?
So, unfortunately, there is no perfect answer for everybody because we are all built differently. We are
Right.
all different body sizes. We have different like cup sizes, all of that. So, the most important thing that I usually tell people is one, if you can avoid underwires, avoid underwires. Just because that underwire digs and that really does prevent lymphatic fluid from draining, which is which they're saying is one of the reasons why women, and it's not the only reason, but one contributing factor as to why women get breast cancer more often than men. That's just one contributing factor. It's not the only one. And not to say that if you wear underwire, you're going to get breast cancer. By no means am I implying that either. But trying to avoid the underwire. The most important thing that I found is finding a bra that fits you. So actually going and getting sized so that it is fitting you and supportive to you. And if it is an underwire, that's fine. But what I tell women to do is when you don't have to wear a bra, don't. Just don't. Like when you're at home cooking or you know what I mean? Like wear like a tank top that has like the little like shelf kind of thing that isn't super tight if that's something you want, or wear a t-shirt or um I currently wear like the packed bra, like their little like bralette kind of things. Um there's no clasp, no nothing. It's kind of like a sports bra, but it's organic cotton. That works well for me, but I'm not a very large, well-endowed female. So that may not work well for everybody. But ultimately, wear it the least amount of time you have to. And then when you take it off, do some drainage just to get that fluid flowing so that it's not stagnant. Um, it's really important, especially for women that have like dense breasts. Actually, I was just told this like a week ago in my academy. One of my academy members for 20 years has been told like she has dense breasts and she has to go and get different scans done because of how dense her breasts are. And she went just a couple weeks ago, and this is the first year that she's does not have dense breasts. And she's like, I did not know that moving my lymph would help clear like the density in my breast tissue. And I'm like, yeah, like how amazing is that? And it was just because she started to like move some of the fluid in and out. So it's just so important that one, we wear one that's properly fitted to our body. Two, we wear it the least amount that we have to. And then three, do some drainage after you take it off. Like that's it. Because there's no one size fits all solution. Like I'm not going to be like, well, we all have to go braless because that's just not a solution for everybody. So, That's what I usually recommend.
Yeah. This has been so awesome. I think my takeaway from this is a constant and consistent, not constant, but a consistent and diligent practice that if we want to really have a healthy foundation, a healthy body, a healthy lifestyle, that working on the lymph has to be or needs to be a integral part of that and a daily practice to really and multiple times daily probably, but it doesn't take long. That's the
Mhm.
thing. Like what I have learned is like this does not take long. Before I work out in the mornings, I always work on the lymph. I get on my vibe and it's so like quick.
Mhm.
It's less than 2 minutes in some cases. If
Yep.
I want to do more, maybe it's more, but it's not long. It just, as you said earlier, the awareness to remember, oh, you know what? I've been sitting for like 4 hours. Maybe I should get up and, move things, dance, move, walk,
Mhm.
work on the limb. So that's my big takeaway for just it's consistent, diligent, and just becomes part of a lifestyle.
100%. And when you learn it and you fully understand it, because my goal is I want to teach it so that people understand it. They don't just memorize it, like they understand it. When you understand it, it literally can take you 2 minutes to open up your specific 7 lymph nodes, or maybe 3 or 4 minutes to do the total 12. Then it can cut way down. Like if you're somebody that has a lot of congestion, you may need more. You may need to do it more often in the beginning. But then you can cut it back. And just like you said, getting up, moving your body, doing things where we know we're supporting, like staying hydrated, making sure we're drinking clean water with the proper minerals in it so that we can absorb it. Like there's just simple things that we should be doing on a daily anyway. And when we can, what I wanted to say was habit stack. So when we can do things like in conjunction with something we're already doing, it makes it easier. So I have some of my like members who are like, yeah, like while I'm waiting for my coffee, I'll open up my lymph nodes, or, while I'm sitting on the toilet to go pee, I'll open up the top lymph nodes, then I'll wash my hands and then I'll do like my groin and my knee after I wash my hands. So, I'm getting it twice a day kind of thing. Like I'm not doing it every time, but they're doing it while they're already doing something else. And so it just makes it easier to implement. And then when you are consistent, just like you said, and you start to see changes in results, you're just like, okay, well, this is great. Why would I not do this kind of thing? So
Absolutely. Well, thank you so much for being on today. It's just been fun to talk with you, but the insights, the value that you've brought is just awesome. And it's going to be so beneficial to people. Where can they find you?
yeah, so you can find me on Instagram, YouTube, Facebook. Those are probably the big places. YouTube is newer; it's longer format, obviously. But yeah, so that's a new adventure for me. It's interesting. I'm learning all sorts of fun stuff with social media. But that's the best place that people can find me right now.
Awesome. And it's doc.tox.detox.
Right?
So,
Even though I talk drainage, still detox.
well, thank you so much. It's been awesome.
Thanks for having me, Randy.
You are very welcome. So thank you all for listening to our podcast. Thank you for being a part of this, being a part of our community. Please like and share this. It's so beneficial to get these messages out. If you found value today and you think of someone that, man, they could use this, doesn't take much to share it. It's super simple. So thank you. And as always, keep it real.